the details of the webinar, I'd like to share with you some housekeeping items if you're new to this platform. Slides were sent for the materials this morning to those that are registered. If you registered late, you can also access the handouts in the Handouts section of the GoToWebinar platform. This webinar is being recorded so that we can share it with others who were unable to attend live. We do ask that you please dial in using the telephone option if you are able. You'll be prompted to enter your audio PIN, and this will allow us to have a discussion at the conclusion of the webinar. At this time, all participants are muted. Our panelists are unmuted. If you do have a question, we'd like to hold that question until the end of the webinar, but you may do so in two different ways. One, you may raise your hand by using the palm with the arrow on it in the GoToWebinar platform. Hopefully you can locate that now, and I would ask that you practice using that so that we can make sure that you can ask your question later. Please do so if you are dialed in using your telephone only. If you dialed in using your computer's audio, you may ask a question by accessing the questions platform in the GoToWebinar platform. And Wanda encourages you to get warmed up with what she calls a very, very meaningful and purposeful question to get us started. So if you don't mind chatting in now your favorite Virginia restaurant, it's very important. So go ahead and type that in now. And again, we'll hold questions until the end. And with that, I will turn it over to Wanda Clevenger. Wanda?
Thank you, Betsy. Okay. Thank you. Well, I'd like to welcome everyone to today's webinar. We're very excited to get this project rolling. I would first like to introduce your VA NICU Early Intervention Support Team. From the Infant and Toddler Connection of Virginia, we're fortunate to have Catherine Hancock, the Early Intervention Administrator, as a partner in this work. From the VHHA's Center for Healthcare Excellence, Abraham Segras, VP Patient Quality and Patient Safety, Betsy Cole-Archer, Director of Performance Improvement, and myself, Wanda Clevenger, Director of Performance Improvement. So the Virginia Hospital and Healthcare Association, in addition to its legislative work, the VHHA provides educational support to its members through the Virginia Hospital Research and Education Foundation. The VHHA board established the Center for Excellence to assist members in achieving top-tier performance in quality, safety, and service. As I mentioned, an important partner in this collaborative is Catherine Hancock, the Administrator of Early Intervention. I will now ask Catherine to speak about and provide us with an overview of early intervention services. Catherine?
Catherine, it looks like you may have muted yourself. Please make sure your line is unmuted.
Can you hear me now?
Yes.
Are you able to hear me? Okay, thank you. All right, sorry. Thank you for allowing me to talk today. I see a lot of familiar names on the list of people who are participating, so that's great to see. So that some of what I'm going to go over will be familiar to you. I'm just going to give a little bit of information about early intervention, and early intervention just recently celebrated its 30th birthday, and the legislation was is part of the Individuals with Disability Education Act, and it ensures that children who are through age 2 have access to services to help them with developmental delays and be ready for school ready and for participating to the best of their abilities in their everyday activities. The lead agency in Virginia is the Department of Behavioral Health and Developmental Services, and there are 40 local lead agencies. Many of the system managers are represented on the call today. And they, for those who aren't familiar, early intervention services are primarily delivered in natural environments. And by that I mean in settings where typically developing children are going to be. They might be in the home, a library, going shopping at Walmart. And the focus is to help children develop the functional skills that they need to function just like their typical peers do. And as you also know that when we start services earlier, they are have the best ability to impact and improve the quality of the child and the family's life. With the amazing amount of brain development that occurs through the early years, we want to capitalize on that and help families, teach and help their children to develop to the best of their ability. On this slide, you'll see a link to the YouTube, and that is an introduction to early intervention. It's a little too long for this call, but it's very well done, I think, and it's about families' perspective on what early intervention means to them and how it works. So I would encourage you to look at that if you have questions. So now I'm ready for the next slide. Thank you, Wanda. Just briefly, some of the indicators for early intervention. These are the eligibility criteria. There are three main categories. A child might be eligible based on a development being 25% below their developmental age. In a specific category, they might have atypical development or behavior. They may have a diagnosed condition that will very likely cause a developmental delay. And some examples of that are genetic disorders such as Down syndrome, cleft lip or palate, autism spectrum disorders, vision or hearing loss, and probably what we're most interested in today is a NICU stay of greater than or equal to 28 days. Also, children, to determine their age for this program, it's going to be adjusted based on prematurity through until they're 18 months of age and older. On the next slide, it shows you a little bit about where the programs are located throughout Virginia. Each place that there is a number is one of the 40 local lead agencies, and then you'll see the names underneath there just to show you where we are as part of the Virginia. And the different colors represent the regions, and that's just sort of an organizational structure for us. So I will turn it back over to Wanda.
Great, thank you, Catherine. And Catherine will be available for the question session at the end of the presentation. So the aims of the collaborative are to understand the challenges faced by the system and to achieve changes of practice and improvement in outcomes for all infants, young children, and families through this work. And while Catherine mentioned early intervention has been around for 30 years, it's important to revisit these initiatives to make sure that we are reaching all infants and families that would benefit from these services. So this is an 18-month project of working together. Our intention is for systems, processes, and these relationships to develop over the course of the collaborative so that they're sustainable and continue this work going forward. So how will we achieve our aim? Well, these are those things that sound simple but then get complicated as you get into the work. But the collaborative will allow the participants to establish a mutual understanding of the baseline, to spread evidence-based best practice, share learning, monitor outcomes through data, and establish connection to local and statewide resources. The activities completed and underway are summarized here. On the left side of the screen are tasks completed or ongoing. On the right side are the focus of this quarter's work. These tasks will be important for the future of the collaborative. So we have formed the advisory council. We are exploring existing patient and family advisory councils and then conducting the needs assessment. And we'll discuss each of these as we go through the presentation. But first I'd like to welcome the hospitals who have committed to the project and the collaborative. We have 22 hospitals signed on. And we received a great reception when reaching out to the NICUs and sharing this work and the focus of the collaborative. And so I'm very confident that we will achieve our aims in this work. This slide shows the hospitals participating, as well as the regional divisions of the early intervention program. So you can see in some areas like the Southwest and South Central areas of Virginia, there is a lack of NICU support in those regions. And in speaking with the early intervention system managers, we've learned that many infants and families do receive services out of state in North Carolina and in the also in Tennessee and in the northern areas in Washington, D.C. And I would like to welcome, we do have Children's National from Washington, D.C. who have enrolled in the project. I have reached out to some other out-of-state hospitals, and we're hoping that they will join the collaborative as well. This is the Collaboratives Advisory Council, and we're very thankful to the individuals who agreed to serve on this council. The council is designed to guide the work of the collaborative, which is very important because throughout Virginia there is a lot of variations in practice, and so this council will serve to help us identify best practices, to facilitate cooperation and agreement, to help us look at the data and provide feedback and insights regarding current barriers and opportunities for improvement. And so we are looking forward to our first meeting, which will be on February 14th, and following that we will begin the data collection process. In addition to the Advisory Council, another important group that we need to hear from is the patient and family. And to this end, we don't want to recreate a wheel that may already be out there, and so I am in the process of interviewing and learning from leaders of existing patient and family advisory councils. I've learned of the ARC of Virginia New Path, which utilizes a newsletter and a blog and a website as mechanisms to educate, inform, and support families. And I'll also be attending the Virginia Interagency Coordinating Council with the goal of identifying who we can best partner with to have ongoing input from patients and families regarding their experience with NICU and access to early intervention services. So how do we know that there is a problem with referrals or access to early intervention? Well, that's what we're going to be discovering as we go through this project. We know that early intervention serves children and infants between age 0 and up until 3 years of age. And these charts show on the left-hand side, this is the total population of infants and toddlers up to age 3. And on the right-hand side, we have children served each year by early intervention. Now, the numbers served here are not new cases. Some of these cases roll over because there's a continuation of services. So this is an aggregate, not just new referrals, but we're looking at new referrals as well as cases that were carried over from the previous year. And when we took those numbers and just looked at what the percent of individuals served, you can see that while the population for the infants and toddlers has stayed relatively stable, there is a slight increase in that population being served, with in 2015 it being its highest of 4.1%. And looking at the early intervention data over on the right, the trend line there shows an increase in services with a projection for that increase to continue. So if we're looking at a relatively stable line of population served, what other considerations are there to make regarding the need for early intervention services? And you can see on the lower right-hand corner, there's a slide from the Virginia Department of Health which talks about factors that affect health. And in addition to medical services, there's many social and economic factors that will be indicators for whether services are needed or not. And so when we're looking at this population, that may be a consideration that we will need to make. Above the, in the upper right-hand corner, you'll see the number of neonatal abstinence syndrome cases in Virginia, and this is trending from 1999 to 2013. And these infants do require, additional care and attention, and there's been much made of the epidemic, the opioid epidemic here in Virginia, and so this may be something that we will need to include in our baseline data, looking at individuals benefiting from early intervention services. Premature birth is another source of patients for early intervention, and I'm happy to say that Virginia's percentage of preterm birth rate has gone down, so we're at 9.2%, which is less than the national average of, I believe it's 11. So, but that's still a group of cases, patients that would benefit and participate in early intervention. So this slide shows us some information about Virginia's early intervention referrals. So who refers to early intervention services? Primarily it's NICUs, NICU follow-along clinics, pediatric specialty clinics, pediatrician offices are the main referral sources. Families can also self-refer, and the numbers here don't separate the referrals by referral type or referral source. That's something that we'll have to pull out going forward with this project. But I thought it would be beneficial for us to take a look at these numbers from 2006 and see that of the 16,000 referrals that were made, 60% went on to receive early intervention services. Now, a number of the cases, there are problems. You can't contact the individual once they're discharged from the hospital. They may have declined evaluation or assessment of services, and there was another group that were determined ineligible after the initial evaluation. And that could have been due to a delay in the evaluation. They may have been referred to other services. But it's important to note that even if an infant is determined to be ineligible with the initial evaluation, they can always be re-evaluated at a later date. So it doesn't disqualify them from services. So thinking about that slide and thinking about the aim of our project, which is to improve access and referrals to early intervention, we need to understand the challenges that are faced in terms of engaging the parent in early intervention services. And we want to understand how best to engage a parent who may be overwhelmed. Many infants, when they're discharged from the NICU, have compounding medical conditions that take priority over the social developmental conditions. There may be a teen parent involved, an addicted parent. The parent could be in denial. Many parents are without a stable home or are homeless. And so much of that is out of the control of the NICU. And so it's important to look at models that are in place in existence that have been successful with those. And hopefully we'll find some of those. Why not hopefully? I know we'll find some of those in Virginia and be able to spread those practices. But another concern was how to best clarify roles and support from NICU specialty clinics, pediatrician, early intervention, and the Department of Education. So there's just the parent being overwhelmed with the infant's needs and the infant finally coming home, but then having all of these other pieces and not knowing who's supposed to do what. So some coordination and clarification in that area would be important as well. And then there comes the access to services and the completion of forms for Medicaid or other support that parents may not be aware of, and so how to best educate and communicate that information. So it's a very complicated process. It isn't just faxing over one form. And when I've talked to the NICUs, not in a formal survey, which we will be conducting shortly, but just insights from conversations, these were some of the things that I took away from those conversations, that there is a lot of variation in how referrals are made to early intervention. And so factors such as the timing of when a referral is made, the information provided, the education provided to parents when they're first introduced to early intervention services, and then also some misinformation that exists related to early intervention services. So we want to be able to, again, look at data related to how practices, what the practices currently are, and then looking at the outcomes of those practices, identifying the best, and then creating a transition to be able to help everyone with the best practice for the population that they're serving. One piece of data that we don't have that we will be collecting as part of this project is tracking the quality of the referral. And what I mean by that is when a referral is made, that they will go on to have the assessment completed and stay engaged in terms of the recommendations made by the team. So I mentioned best practices, but how will we know a best practice when we see one? That's really the challenge here. And we're going to need your data, quantitative as well as qualitative. We'll be asking data from the hospital environment, the early intervention team, the patient and family through feedback and surveys, and then also the Virginia Department of Health. In addition to the data, we will be collecting stories, because stories are a way to help utilize the data for transformation. So what changes can we make that will result in an improvement? We will be collecting the policies and procedures that you currently have around early intervention referrals, discharge practice, discharge forms, and looking at documents that are sent at the time of discharge. And once we identify the best practice, we will develop and conduct training programs at your sites, and then we'll be facilitating a dialogue between NICU services and regional system managers. We have, when I mentioned variation in practice throughout the state, there are some NICUs that have the early intervention case managers come to their units as part of their discharge rounds on a regular basis. And I was recently at a region where the hospital NICU case manager goes to the early intervention regional system managers meeting. So we want to evaluate those systems and see what really works best for the population served. So what we're going to be doing this quarter, January through March 2017, it's really the foundation for our improvement work. So we're going to be conducting the needs assessment, collecting baseline data, performing a gap analysis, and then begin the work for the change package. So the needs assessment, we will be sending out to the NICU leaders a NICU survey link and a request for information. And what we'll be collecting will be your policies and procedures, educational materials, materials related to your discharge rounds, discharge summary, documents that accompany EI referral, and any other information you have that you feel influences, supports this process. Once we have the information in the survey completed, we will schedule site visits to come out and work with your team, and also it's an opportunity to share recommendations and findings. The early intervention program will also receive a survey link and a request for information. So our baseline data, this has been a challenge for me, and it has led me down many rabbit holes, and so part of our work will be agreeing to a true data source. And what I mean by that is there are known data sources. So first we'll talk about the Virginia Department of Health and the Virginia Health Information website, and then the Infant Toddler Online Tracking System. And so the Virginia Department of Health, well, the Department of Health only captures information for around infant birth, admissions, services through data entered on the birth certificate. Their most recent data, you can see there's a bit of a lag, is from 2013, and they don't have trended data because the NICU admissions was only added recently. And there is a large discrepancy between the data, what we have for 2013. So when I look at the Department of Health data and then look at the Virginia Health Information, the VHI data, we can see that there were 5,029 NICU admissions in 2013, and then in 2013, the same time period, from VHI, we have 9,244 discharges. And I think that that increase could be explained by infants transferred to the NICU after birth. They may have developed a complication or decompensated and then needed to go to the NICU. However, when I look at the VHI data, it seems, the first 2013, 2014 seems okay, and then I get to 2015 data and it jumps quite significantly. And so I have hesitancy about using the data, in part because the VHI data does not specify NICU as a bed type. So the data specifies infant intermediate, infant subspecialty, and infant specialty. And so I need to survey the providers, the hospital providers, to understand how they're categorizing those beds and see if we can come up with an agreed upon definition of a NICU bed. And it may not be important because you may be referring to early intervention from all of these beds, but I think it's important that we're all on the same page going forward with this. And lastly, the Infant and Toddler Online Tracking System. This is what early intervention uses to capture information about cases being served and services delivered. But this is a rather limited data set, and it's not linked to other state systems. So I'm sharing this with you to say that in order for us to move forward with the work of the collaborative and to really begin to identify measures that we want to base our performance upon, we're going to have to have a meeting of the minds to come up with what data we want to ask for and how we're going to collect it. I have a draft of that I'll be sharing with the advisory council, and once they review it, then we'll pass it along, and that'll be next week. But again, we want to make sure what we're collecting, we're being consistent in, and we're all using the same definitions. And I would ask if anyone has inputs or suggestions or another data source that we could use, that would be great. I did go to the March of Dimes data set to see if I could find usable data there. And there is good data. However, it's, again, there's a lag in the data. So I think that we would probably get the most recent information from the VHI site. However, we just want to make sure that we're pulling it correctly. Or we may go directly to the hospital NICUs and then just ask for their discharges for a particular group over a time period.
Wanda, we're getting some comments in the chat about infant does not necessarily mean newborn, and the majority of NICUs are part of the Vermont-Oxford network. So that seems to be something that perhaps we can make a note to look up.
Yes, I did see that, but I didn't appreciate that the infant doesn't include neonates, because this is, when I called the Department of Health, this is what they directed me to. So that is, I will make note of that. Thank you. Are there any other questions, Betsy, on this particular issue? Okay,
no,
thank you.
Mm-hmm.
So our gap analysis, our goal is to utilize the baseline data, have ongoing data collection from hospitals and early intervention, review the policies and procedures, compile the survey responses, and then obtain feedback from the patient and family council. And we want to establish a link between these data sets so that there's a feedback loop so we can look at when a referral is made based on a certain program that a NICU has in place. Is it a good referral in the sense that the patient and family agreed to the assessment and were amenable to the treatment plan? So we want to be able to look at that piece of information and, again, learn from it as we go forward. So our next steps are the Advisory Council will have a webinar conference call next week, and then following that, the NICU survey link will be going out along with the data request, and then the same for early intervention. A survey and a data request will be sent out. And then once that information is returned, we will be scheduling site visits. And I want to thank you for your time and cooperation, and we will go on to questions. And Catherine, if you could open your line as well in case there may be questions that you could respond to.
Certainly, I am here.
So, Wanda, our first question is, will you be able to determine the role of participants on today's webinar? Be very interested in how many attendees are early interventions and who else. So, yes, we'll have a report generated from who attended, and we'll be able to tease out who was from the early intervention side versus who is from the NICU side. So I think that would be very helpful. So we'll provide that to you all. If you have questions for Catherine, Wanda, or myself, please go ahead and either raise your hand if you called in with your phone line, or submit your questions into the chat. Okay, let's see. Looks like Caroline Woodward may have a question. Caroline, I'm not sure if you've dialed in with your phone. I'm going to try to unmute your line now.
Hello, can you hear me?
Yes, ma'am.
Oh, good. Okay, I just had a quick question about this process. Our particular unit, we're in Mary Washington, Fredericksburg. We do not have we don't have a high-risk follow-up clinic. Sorry, I'm looking for the right words. We actually refer out to either Richmond or Washington, D.C. Children's Hospital. So is that at all, like, are we out of, should we self-eliminate because we don't have a high-risk follow-up clinic, or is that okay to still continue to be a part of it?
This is Wanda. Hi, Caroline. The high-risk follow-up clinic is not a requirement to participate, so yeah, so you'll be fine.
Okay, great. That was my question, because I kept thinking we had one years ago, and we had a process, but then we didn't have the resources to continue doing it, so we outsourced our babies to those high-risk follow-up areas, and then we obviously refer them to the early intervention as needed. So I just wanted to make sure we weren't going to be excluded because we didn't have that service. So I'm glad to hear that.
Yeah, I mean, and one piece of data, we'll see what the advisory council thinks about, but we have the NICU referrals, but as I've been researching this area, there are a number of referrals that come from the follow-up clinics as well, because at the time of discharge from the NICU, the infants may not be ready for early intervention at the time of discharge. So it's, it's something I'd like to run by the advisory council and get their thoughts on, just as another data set to include in this work.
Okay.
So thank you, Caroline. I'm going to close your line now. So Wanda, we had a clarification question about the timeline for site visits. Correct me if I'm wrong, but we're planning visits after the survey goes out and we kind of accumulate some of those results, and then we'll kind of take that nice package back to the hospitals with the site visits. Anything else that you would add for that?
No, I think that's all that we would. I mean, we'd be working with that. We'd also have not only from the sites data, but also from the early intervention region that's working with that particular, in that particular area. We would also have information from the individuals that have been, or the patients that have been referred to earlier intervention. So we may have some data on their referral status and the outcome of their referrals.
Yeah. So Jill, it will seem probably later this spring is when the site visits. Hopefully winter will cooperate and not get in the way of any of those site visits. So look for us to come a little later in spring. And then, well, the next question, that language is consistent with the state designations for newborn care. Intermediate level nursery, special care, and subspecialty are considered NICU. So that's some clarification for kind of that nomenclature from Kristen Grimes. Thanks, Kristen. So any other questions from the group? Either raise your hand or please chat them in.
Betsy, I have a question. This is Wanda. What was the most frequently mentioned restaurant in Virginia?
Well, actually, we didn't have a mode from that. We did not have a mode. We had Burger Batch, which I know is here in Richmond. We had the Local in Charlottesville. The Depot, I'm not familiar with. Ray's the Steaks in Arlington. Pierce's Barbecue in Williamsburg, and Harpoon Larry's in Good Newport News. So lots of good feedback on places to go and oh, and we're getting in more. Oh, Stanton is where the Depot is, and the Tavern in Abingdon, and Trummers on Main and Clifton, Virginia. There is one more question too. Will there be any live meetings in the future? And Wanda, I'll go ahead and answer that. Yes. So once we kind of get through this gap analysis and the needs assessment and and the site visits. The whole idea for this whole collaborative is identifying those best practices and then sharing them in-person meetings and hosting these trainings so that we can widespread to multidisciplinary teams what are the findings and what have been identified as the best practices. So absolutely, we look forward to hosting in-person training sessions. So thanks for that question, Dina. Oh, we now have a mode because somebody else said burger batch. So thank you, Aaron. One of the other questions is, are NICU stays greater than or equal to 28 days a criteria in general for EI referral across the state? Catherine, do you want to take a stab at that?
Yes, that is one of the, well, I'll use the term automatic qualifiers if a child is in a NICU, and we've also defined that as a step down. You know, anything other than the regular newborn nursery, they qualify for early intervention service.
So that, correct me if I'm wrong. Yeah, so correct me if I'm wrong, does that also include those that stay in the PICU?
It will depend. I would think probably newborns, 0 to 2-year-olds, yeah. Well, actually, no, it's a neonatal is the intent. So it's a premature and neonatal. So if a child was in the, like an older child, other than if it was in a PICU, I think we would look for other criteria. But I think the NICU part is intended to be related to newborns.
Okay. So our next question is from Jenny. Thanks for your question, Jenny. Hello, I work with the VCU high-risk infant follow-up clinic. I noticed there are several areas which consistently our infants are getting lost, quote, lost, to receiving early intervention. Will we be looking at areas of early intervention referrals to identify how we can improve services for specific areas in Virginia? Wanda and Catherine?
Well, this is Catherine. Go ahead, Wanda.
Oh, no, go ahead, Catherine.
Just because I think that is my hope for this. And certainly with early intervention services, parents can refuse. It's not, you know, if they decide that they don't, you know, want the service, it's a voluntary program. We certainly want everyone to partake as possible. And there are also other reasons, too. So I do hope that this project will help us identify those factors when, you know, perhaps what's the best time to contact the family or, you know, following up with them in a certain amount of time. And Wanda, I don't know if you want to add to that.
Well, I think as I've gone around to the different regions, there is variation and there are different social considerations that have to be made. So I think that will drive some of our work regarding recommendations for those NICUs in terms of how best to engage that population. So it definitely will be part of the work. It won't be a cookie-cutter approach to this process at all.
Thank you, ladies. So we don't have any more questions at this time. I would invite our panelists to maybe remain on the line for the next 5 minutes just in case somebody has a question that they didn't think of prior. And then I guess at this time we can conclude the webinar. Panelists, please remain on the line. You're very welcome, everyone. People are saying thank you.
Betsy, you're very proficient and calm with the running the webinar.
Oh, thanks.
Yes, she is.
Oh, and we have some excitement about the project too. People are chatting in now too. So good job, ladies.
I've definitely heard that people are looking forward to this. So I think it's great.
Very good. Okay, well, it looks like we're not getting any more questions coming in, so I will conclude the recording and we'll pause the webinar. Thank you.
Thank you, Betsy.
Bye-bye.
Bye.